Hey, what's going on, everybody? Dr. Zach Long, Doctor of Physical Therapy here, lead faculty for ICE's Fitness Athlete Division. For those joining me live on Instagram, this is going to be a live podcast on the PT on Ice podcast, which for physical therapists is a wonderful podcast to check into to learn from some really great physical therapists, including the Fitness Athlete Division. Today's Fitness Athlete Friday, best day of the week. Really excited to talk today to everybody about some tips for better cues and better coaching. So this past weekend, I got to go to Seattle in Washington and give a course to 20 physical therapists and a couple strength and conditioning coaches, CrossFit coaches, and then got to spend a lot of time afterwards reflecting with some of the course participants on what they learned this weekend and what they saw in the cues in coaching from other practitioners within the course. And I just came away with some great things that I think is going to be really helpful for a lot of people to listen to in terms of improving the way you coach human movement and improving the way that you use cues to improve human movement. So let's dive into the 5 tips that I'm going to share with you today for better movement analysis, coaching, and cueing. The first is that we need to, when we analyze the movement, let's take a squat for example, we need to analyze that movement and look for the most prominent fault. So what do I mean by that? So let's say somebody's squatting, and as they descend down, their low back rounds, their knees collapse into valgus, where their knee comes inside of their feet, and they don't squat to a good depth. So we've got 3 movement faults in there. Too often, we're going to spend a lot of time trying to coach people, through the lumbar spine position, then the knee position, moving through all the movement faults we see and not taking 5 seconds to stop and think about this movement and determine which of those faults is the one that is most likely driving the other ones or causing the greatest impact into that movement pattern being poor. So for example, if we've got that lack of depth, knee valgus, low back rounding, I'm going to look at that, and where I'm probably going to go most often is I'm going to correct that knee valgus. Because a lot of times if that knee's coming in, the hip is going into a little internal rotation, and that's going to lead to the hip socket being put in a position where it can't squat to as much depth. And so that knee valgus may cause the lack of depth, and it may also cause some of the lumbar rounding because we might posteriorly pelvic tilt to move the hip into a position where it can go a little bit lower despite that knee valgus. So if we focus on fixing the low back position first, and don't address the knee position, there's a very good chance that we're not going to get as far as if we had chosen the fault that was most likely to be the driver of multiple things. So we really need to spend the time to identify the most prominent fault, because that's going to make everything else a lot easier. Now, identifying that most prominent fault is not often easy, especially if you're, just starting to get into analyzing human movement at a deeper level. So people ask me all the time, how do I get better at this? How do I get better at coaching or cueing or identifying this most prominent fault? The answer is simple. You do this a lot and you mess up a lot and you choose the wrong most prominent fault and you work on it for 3 or 4 minutes and you get nowhere and you have to go back to step 1 and work on a different movement fault. But once you've done that and spent the time going through this process of every single time you identify human movement, trying to identify that most prominent fault, you're going to mess up a lot, but then you're going to get to where you recognize these clinical patterns a lot better, and you're going to be able to skip steps and get stuff done a lot faster. So really make sure you take the time to sit and think, I saw these faults, and this is the one that I believe is most important in this movement pattern. From there, we need to go about cueing and trying to correct that most prominent fault. And we want to stay really simple with our cues. So many of us as physical therapists or strength and conditioning professionals that are listening to this have a lot of knowledge of human movement. And so we want to go at this at these long, detailed explanations of why people need to do this or how to do these certain things. Well, let's be honest. The patients and athletes that come to see us, they don't have that knowledge that we do. So we need to use as simple of corrective cues or strategies as possible. We don't need to mess with their mind too much. They've got too much going on, too much to think about. They're having pain, or they know that they're not performing as well as they could. Keep this stuff really simple. So we're going to use verbal, tactile, and visual cues to try to improve their movement pattern, focusing on that most prominent fault. And we're going to try to keep that to 1 cue at a time. Because too often we're going to come into that person who's squat, they have knee valgus, low back rounding, and they're lacking depth, and we're going to say, all right, I need you to push your knees apart, I need you to keep your back more upright, and I need you to squat lower. And that athlete's just like blown away. You just told them so much about a movement pattern that they have very little knowledge about, and we've just overloaded them and put them in a situation where they're not going to be able to effectively learn. So choose one cue, whether that's verbal, visual, tactile, give them one, see how they respond, and adjust as needed. If that one cue produces a positive outcome, then great. We'll talk about what to do next. If it doesn't, try something different. Maybe you told that athlete that had a little knee valgus. Maybe you said, all right, I want you to try to push your knees apart, and that didn't work. So maybe now we go to an analogy, because analogies are great to help individuals learn new movement patterns. So maybe instead of push your knees out, maybe we say, hey, I want you to imagine that there's a giant rubber band around your knees, and as you descend down into the squat, I want you to try to break that rubber band in half. I want you to spread your knees so hard that that rubber band just breaks in between your legs. Analogies are so underrated when it comes to providing cues that it is my go-to strategy as soon as I start coaching somebody. If I can think of an analogy that will work, I'm going to go analogy above all else. I may come in for that same cue of knee valgus. I might put my hands around their knees if they're not catching my analogy and say, I want you to drive your knees out into my hands as hard as you can. And I give them a tactile cue. Or maybe I go visual. And I do a squat where I demonstrate a little knee valgus. And then I do another squat where I drive my knees out so that I'm keeping my knees in line with my toes so that they can visually see that. I want to find the strategy that individual best responds to. If you're in a coaching situation, you're a little bit of an advantage because you've probably seen these athletes a few times and you kind of can recognize, is this an individual that responds better to verbal, tactile, or visual cues? If you're in the physical therapy clinic and this is your evaluation, it might be a little more difficult. And you might have to run through these 3 strategies really fast. Now, once we've found a cue that has helped improve an individual's movement pattern, so we cued that individual to break the rubber band around their knees to correct that knee valgus, and now they're squatting to better depth, and their low back's not rounding, we need to talk about the frequency of feedback. Because far too often, we then give too much feedback. And so, it's to say an individual's then doing 10 reps of squat, practicing this cue, every single rep we're saying, oh, that was a good one. That was a good one. That was a good one. Oh, you didn't spread the rubber band as well that rep. We don't need to give cues on every single rep. If we do that, we end up not allowing that individual to learn the movement pattern themselves, to create that intrinsic knowledge of what's happening. And so they're going to be 100% reliant on us being there to provide those cues. That's the difference between having good practice and having good learning. We want individuals to have good learning, where they take what we've taught them and they keep it long term, not that they do really well when they're in there with us and then they go back to their CrossFit gym and they look like crap. So the frequency of feedback needs to be lower than we think it does. And there's a lot of research out there around this. I tend to want to get down to 1 out of every 3 reps as quickly as I can so that they can kind of start to develop that feedback. And they can learn from themselves where those positions need to be. Earlier on, that might take more frequency. Later on, it's probably going to take a little bit less. But just make sure you're not giving too frequent of feedback to where that individual can't learn to assess their own movement patterns. So that's tip number 3, is feedback frequency. Tip number 4 is going to be using internal versus external cues. So when it comes to performance and performing movements, research has been really clear that the vast majority of individuals are going to respond better to external cues rather than internal cues. So when somebody squats and they have knee valgus, I'm not going to say, activate your glute medius, please. I'm going to tell them, hey, I want you to imagine there's a earthquake and the earth splits between your legs, and I want you to try to further spread that fissure that's going between your legs. Just that external cue of trying to break the floor underneath them will provide better impacts in performance than giving them an internal cue of activating their glutes or activating their transversus abdominis. People don't get these internal cues near as well. They don't create the same changes in performance. And that's been shown over and over. Now, there certainly are exceptions to that. There are people that have really good intrinsic knowledge of their body, and they will respond to that. You know, if you as a strength and conditioning professional or you as a physical therapist, if somebody came up to me and said, hey, Zach, when you do your deadlift, I want you to activate your glutes more at the top of the rep. I understand what that means. And so I can translate that into my performance. So there are some individuals that will respond better to these internal cues, but for the most part, external cues are going to be better, provide better changes in human performance. There's also a little bit of research out there that will show you that internal cues may be a little bit better for hypertrophy. So if we're doing an exercise with the end goal being of creating greater muscle mass, then that might be a time where we might want to use internal cues. So say somebody's got some glute atrophy and we're programming some accessory work with some hip thrusts in their CrossFit programming. That might be an individual where I say every rep, I want you to concentrate on squeezing your glutes as hard as you can. And that may, according to some research, produce some better outcomes in their hypertrophy. But if we're looking for performance, we're going to be more likely to be using external cues than internal cues. That's number 4. Inside of that, and kind of highly related, is let's use less anatomy talk. When we're trying to identify why somebody's squat pattern's messed up, maybe they're going into knee valgus because they have a lack of dorsiflexion. Well, let's keep this simple. Our athletes, especially for those of us as physical therapists, our athletes don't have this in-depth anatomy knowledge. So that's not say, hey, your ankle dorsiflexion is messed up, your midfoot range of motion, your midfoot stiff, whatever it may be. Let's be generalized. Let's just say, hey, your ankle mobility is not that great in this direction, and I think improving that's going to help you out. Keep it simple. Keep it on the level of the individual that you're talking to. Because we're already going to be throwing so much knowledge at them that if we then overload them on top of that with anatomical details, we're going to have less good outcomes. They're going to remember less of what we said. All right, tip number 5 is going to be let the athlete learn. Sometimes when we have multiple movement faults, we need to identify that most prominent fault. We go through correcting that, and you know what? A lot of times their movement still won't look perfect. Maybe we've corrected that one prominent fault. But there are times where we need to sit back and realize that I've already given this individual so much to think about, so much to retrain in this movement pattern, that I'm not going to worry about pushing perfection today. Today, I'm going to be happy that we have made a 25% improvement in the overall quality of this movement, or a 50%, 75%, whatever it is. We don't always have to chase perfection. And so maybe we corrected that individual's knee valgus, but they still don't have great depth, or they still round their lumbar spine a little bit. That's okay. It's fine to let them play around with that for a few sets. It's fine to let them play around with it for a week, 2 weeks, 3 weeks, before they come back and see you again, and then you try to address the next thing. Give them time to develop their intrinsic knowledge of how their body moves. Give them time to understand the cues that you gave them, and then come back to more movement faults. But don't be afraid of sending them out with a less than perfect movement pattern and giving them time to let their body figure out how to move better. And that can be done with or without load. So many times people have been squatting with load for a really long period of time with really poor movement mechanics. And we as physical therapists or strength and conditioning coaches, when they finally get in our door, we want to completely stop them from moving because, they're using some faulty mechanics. Well, maybe we improve one thing and it's still not great. That doesn't necessarily mean that we have to completely stop that movement pattern. They've been training with that dysfunction, I hate saying dysfunction, with that movement pattern for a long time. Let's make some minor cues and we can work towards perfection over the next sessions. But a lot of times we just need to let athletes learn to move themselves. So let's go through those 5 tips again. Number 1, identify the most prominent faults, especially if there are multiple faults. Then we're going to use simple cues, whether verbal, tactile, or visual, to help improve that movement pattern. We're going to not use too much frequency in our feedback. We're going to focus on using external cues more than internal cues to get those changes in movement patterns. And then we're going to actually let our athletes learn, whether that's from decreased feedback frequency or just by letting them go out and play and explore their own bodies and how it moves. Hope those 5 cues are helpful for you. For the physical therapists out there, Institute of Clinical Excellence has some cool courses coming up. If what I just talked about is interesting to you, we've got 2 courses coming up really soon in our fitness athlete division. And then September 8th and 9th, Mitch will be in Washington, D.C. talking about it. August 25th and 26th, next weekend, Jeff Moore will be in Nebraska teaching a lumbar manipulation course there. And then at the end of September 28th through 30th, we've got a huge event coming up. That's our Rising Tide event, first annual Rising Tide event, where we've got Mike Eisenhart, Chris Johnson, Jeff Moore, Jen Shelton, Tim Flynn, and many more coming in to talk. That is an awesome lineup of speakers. I'm really excited to go. So if you're a physical therapist, you really need to check out the Rising Tide event. This is going to be a game changer. Hope everybody got a lot out of today. Have a great weekend.